Now move to the next issue in orthopedics which we'll be discussing, and this is the Volkmann ischemic contracture. This is a very nice hand. In fact, looking at this hand, you have learnt everything about Volkmann ischemic contracture. So for the Volkmann ischemic contracture, we said that it's a serious complication, and of course it comes in because there have been untreated and prolonged ischemia. Ischemia simply means loss of blood supply, so sometimes even the nervous system gets affected. So here we are talking about the muscles of the forearm. So they have been affected so long, and it leads to what? Permanent shortening of those muscles. Okay, can also lead to fibrosis, where there's now death in all those tissues. You understand? Of the muscle. So causes is prolonged ischemia of the forearm flexor muscles. Okay, so it's often due to compartment syndrome. So there's now increased pressure in the forearm compartment. Okay, there was increased pressure in the forearm compartment, so it led to reduced blood flow and muscle necrosis. Okay, that's the cells of the muscle started dying. Okay, so there's healing with fibrosis and scarring. Then tendons pull the fingers into flexion. So common causes, you have the supracondylar fractures of the humerus. Sorry, let me just write something down. Yeah. I don't have my Bible here. Okay, so my Bible is here. Okay, supracondylar fractures of the humerus, tight bandages, crush injuries. You understand? All these things could actually basically cause it. Then arterial injuries. So clinical features include severe pain. Okay, and if you give analgesics, the pain is not reducing. So the pain usually worsens with passive stretching of fingers, Pallor, pulselessness, and paresthesia, paralysis. That's the 5 P's. So late signs, you have all those, flexor deformities of the wrist and fingers, loss of function of the hand and forearm. So prevention is key. Avoid anything that will actually compress the blood supply to the forearm. Then fasciotomy can be done to actually relieve the pressures. Surgical procedures like all those muscle slide operations, tendon lengthening, tendon transfers, physiotherapy and splinting for functional improvement.